This episode was the result of a partnership with YouthBridge Community Foundation through its Think Big for Kids grant. This project by St. Louis Story Stitchers titled Perception Isn't Always Reality will create a public service announcement campaign as trusted messengers about mental health stigmas.
Come stop and take a trip down on my block where you see hidden potential, young minds sharper than Ginsu, and ain't afraid to speak their mind if they got something against you. We standing with you, we tackle issues like civic pride. Hate will cease to exist, let's put our differences aside. From my side to your side, from Dutchtown to South Side, from Penrose to North Side, from Benton Park to Old North, the West End to West Side. We blessed when we step out, we stand down, rise up, stand together, wise up.
This is StitchCast Studio, produced by St. Louis Story Stitchers in St. Louis, Missouri.
In this week's episode, our StitchCast sits down with Dr. Julie Gary, Bureau Chief of the St. Louis City Health Department.
They say who that, but you already knew that. That be them story stitches, story stitches, story stitches, story stitches, story stitches.
I did have a question, because you brought up kind of getting more qualified people in schools. I don't know if that means just better trained counselors and such, and then in the police force, the LGBT community. And I just wanted to, I guess, get a better understanding. So for as far as the Department of Behavioral Health, do you guys just like educate and like kind of get more people to become aware, or do you create policy mandates and enforce, like, this is for different organizations, this is how they have to kind of behave and present themselves for their employees, for their members, for the customers and such as well?
So, okay, so let's start with the first part of the question, which is, do we have an influence over the training of employees, like in schools and things like that? So one of the partnerships that we currently have is, I would say, like teachers, counselors, but then there's also kind of this new category, and it's actually a program that St. Louis Community College has, and it's a community health worker program. So what we find a lot is when it comes to mental health and some other health issues, that it's best to have like grassroots workers who are from that neighborhood or from an organization in that neighborhood that people trust, or embedded in a church or something like that. So St. Louis Community College has like this great community health worker training program. So it's an associate's degree, and those folks are trained to then go out into neighborhoods and work on specific health problems. So you can just get a general CHW, or you can get, something as specific as behavioral health. So I think that's one component of it, but sometimes it's also just training lay people on a particular topic related to something that's going on in their neighborhood, knowing that people in that neighborhood trust them and are going to talk to them about it. When it comes to organizations or policies, we are involved in a lot of training across the city. So we are training in the police academy, the cadets, and talking to them about mental health issues that they might interact with on the street, and the difference between that and someone who might have committed criminal activity, right? So there's a difference in the way we respond. We have this program called Cops and Clinicians, where there is a crisis response unit behavioral health trained person riding along with a police officer. And we have those in every district, but it's not 24 hours a day. So it's training the other police officers then when they don't have a crew member with them. The crew members they wear purple shirts. So I'm not sure if you guys have heard of that program before, but so we are training the police officers, but also training behavioral health response, who is responsible for the purple shirts, on some of those behavioral health issues, and Narcan training as well. So it's kind of this movement that's happening within the city and its community partners around behavioral health, and training them on what that might look like. How might someone look if I came across them in the community and they were having a behavioral health crisis? And what can I do in terms of like calling 988? If it's just a behavioral health issue, that's the best approach. I'm going to call 988 and I'm going to get a counselor on the phone for that person. If it's something like an overdose, I'm going to call 911. If I have Narcan and I'm comfortable administering it, I'm going to go ahead and administer that and wait for EMS to arrive. So it's kind of coaching them on, what might I see in my community? How might I interact with that person in a healthy way to get them the help that they need?
Thank you. I do have a question. So while we were doing research, we saw that you are the author or maybe a co-author of the Health Equity Plan. And we wanted to know more about that and if it would help to mold the perspective that youth and young adults have about mental health.
Yeah, so when I first came back to the city, I was in the epidemiology section, which is our data and statistics group. That's my master's and my PhD are both have training in epidemiology. So I came back and was initially asked to do behavioral health data work, and then got the equity piece added in because it's something I'm really passionate about and something Dr. Mahdi is extremely passionate about. You hear her talk about it in almost every talk that she does. So I worked with the literature that's out there, the other cities that have plans around health equity, because it has been kind of a focus in St. Louis since Mike Brown and Forward Through Ferguson. So I was in a group with Deaconess Foundation, Forward Through Ferguson, the county, and us to kind of work on the equity measurements that were done back in 2018. That was kind of the initial work done with the city, and we started to bring that group back together. And as we brought that group back together, we also understood that if we were going to execute it at the city level, we needed to have a plan in place in terms of training everyone from our animal control officers to our leaders on what does health equity look like in the area of the city that I work in. So if I'm a restaurant inspector and I'm going into, South Grand neighborhood, the way I interact with someone at St. Louis Bread Company is going to be very different than how I interact with someone at Faux Grand. So having that perspective on, okay, what does equity look like in these neighborhoods, and also understanding that from a social determinants of health perspective, so income, education, kind of all of those things, how for some of these neighborhoods, they overlap and put people even behind the starting line to begin with. So how can we, from a mental health perspective, how can we work on some of these other things like education, employment, housing, and influence outcomes like behavioral health? So when we talk about housing, employment, and education from a behavioral health perspective, what you find is that people who in certain neighborhoods who have a behavioral health issue, that compounds their ability to get safe housing, affordable housing, a job, and to get into school and get a degree that could help them get paid even more, or even get into the trades or whatever they're trying to pursue. So we try to think about, we want everyone to, as they approach their job in the health department, to look at whatever it is. If I'm going out to if somebody's had a complaint about a dog in a neighborhood, for example, when I show up at that house, how can I look at this situation from an equity lens to not just say, like, I'm only looking at this from the fact that someone complained that this person's dog is barking or they're off leash or whatever. Instead, I'm looking at it from, okay, what is this neighborhood? What is this person really going through in this neighborhood? And how is that influencing their situation with their dog? And so that's the lens that we're shifting to versus just, I'm showing up to deal with the problem.
Hey, what's going on, everybody? It's that time again. Time for another StitchCast Studio Arts Interlude. That's right, we about to pick the city up. This week, we have a Story Stitchers original song entitled Wade Reprise.
We rise, we shine now. We fly, we soar through the clouds. We rise, we shine now. We never falling down. We rise, we shine now. We fly, we soar through the clouds. We rise, we shine now.
Ayy,
Never falling down.
they got my fuse lit. Ain't nothing I can buy with your 2 cents. Step in my mess and get swept like a broomstick. Ayy, ain't that what happened with dirt, and when I'm at my worst, I can still trust the process. If it's in you, your progress, and make meals out the food that the ones that were bringing you down couldn't even digest, but I digress. Look, never to never, we never falling down. Never to never, we never falling down. We never to never, we never falling down. We never to never, we never falling down. Look, we wanna change and we wanna grow. You in the way, that mean you gotta go. They feeling grace with the people I know. They fill my brain with these demons I know. This happening way too frequent, I know. Say that we equal but treat us uneven, and all of my people make me wanna go. Be you gon' go? Yeah, here I go. I just hope they understanding me. They racking and stacking up all the odds, and I'm still chilling on top like a canopy. Got my sight on the enemy. Tell a press that damaging it like, oh, you offended me. I mean, oh, to humanity. Line them up like assemblies and similes, metaphors and imagery. What's scoring me mentally? What be scoring me mentally be what's scoring them physically. What be scoring them physically be what's all in the history. I just had an epiphany. I noticed the patterns. Know when we say that we matter, it doesn't mean no one else matters. Know that we matter. Know when the bar is too high, we the type that'll go get the ladder. And if we fall off as we climb, then we'll come back and try again after. If we can move forward with this, you for or against. Rising, we shining just when you think you can forget, then the quince is the chorus again.
We rise, we shine now. We fly, we soar through the clouds. We rise, we shine now. We never falling down. We rise, we shine now. We fly, we soar through the clouds. We rise, we shine now. We never falling down.
That demands I pick apart. I'm trying to reach beyond the arch. Can't walk a mile up in my shoes, cause your feet ain't got the arch. I hold my city in my heart. When you realize just who you are, you realize what's truly yours, and they can never take it from. Systematic oppression, trying to blur the vision, but I will never let my people be defined by restrictions. You see the crime rate is shifting, and Corona been vicious, but I'm determined to turn the tables despite my position. Yeah, despite opposition and disloyalty, despite the pain that runs so deep. We rise and we shine and we soar and we flying above slave mentality and all formalities and principalities with shallow feet that try to shadow me. Yeah.
We rise, we shine now. We fly, we soar through the clouds. We rise, we shine now. We never falling down. We rise, we shine now. We fly, we soar through the clouds. We rise, we shine now. We never falling down.
And that is actually kind of transitioned to other city departments as well. So an example is problem properties. So sometimes there are complaints that come into the city about a particular property that, you know, it's in disrepair, the roof's falling in, there's trash and stuff around the outside. And so we're not just sending out the problem properties group now. In a lot of those situations, we're sending out behavioral health and other. So we're kind of all showing up together to show the person living there that, hey, we're not here to just say, like, you have this citation. We're really here to help you understand the resources available to you to address what's going on in your life. And so that is also a shift from an equity perspective that wouldn't have happened before.
Beautiful.
Thank you. Okay, so something that I wanted to ask earlier, because you said that, you know, you witnessed a lot while in the military, and I wanted to ask for people who may listen to this in the future, like, how did you come home and decompress? Like, how did you come home and take on the responsibilities that you had as a mom, as a wife, as a regular person, and still cope with all that you had dealt with in the military?
That's a great question. And it wasn't always pretty. I didn't always do it right. I think coming out of that military culture, you kind of have to like shift your mindset. So I wasn't always in a position where I myself understood that it's okay to ask for help. And so what that's changed for me now in the last, 7 to 10 years is that it's okay to not be okay. And it's okay to tell my kids, my mom, my whoever, my pastor, whoever I trust, it's okay to say to them, like, I'm not okay today, I'm struggling. And I would say an example of that for me is a group text that I have with my kids. It's, at any point, one of us can put in that group text, I'm struggling today, and the rest of us are there to kind of be supportive. So back then, I think I was in the mindset of like, okay, yeah, I'm going to talk to a counselor, I'm going to talk to my pastor, but I'm also just going to read as much as I can about resources that are available to me that might help coach me through what I'm going through with my life. I think now I'm completely different in that now I would be much more open about, and in the last 10 years, I would just be much more open about saying to someone, hey, like, I'm struggling with this right now. Like, what can we do what resources are out there that could help me with this? And I think once people like feel that comfort with someone in their life, it makes it okay. And I would say, like, if someone doesn't have that in their life, like, social support is one of the biggest factors in someone having a successful mental health or physical health outcome. And so helping them find that. So I actually have an employee like that right now who doesn't necessarily have like so she's a helper, which a lot of us are. And I think that's also, if you're a helper, like, you don't always feel comfortable asking for help, right? Because you're the one who always solves the problems for your friend group or your family or whatever. But you still have to have that outlet. So for me, I talked about my mentor, Carl, and how he's my daughter's godfather. So he is someone that I could literally pick up the phone and call. He lives in Washington, D.C., but I could literally pick up the phone and call him anytime, and he would be like, hey, Julie, this is what you need to do. I'm thinking about you. I'm praying for you, whatever, right? So I have those certain friends now that like definitely help me with that. And back then it was more like my military crowd, people who had recently transitioned and things like that. Now that group is very different, but I have like my go-to people. And so I think having those is important. If you don't, and I mentioned that I have an employee like that, so I'm trying to coach them on, okay, what are the things you love to do? I want you to get involved in groups like that. Like Story Stitchers is a great example. It's obvious it's pretty obvious from my initial interaction with you guys that you're all like close to each other, right? And so for her, I'm coaching her on, okay, these are things you love to do. I want you to start going to do them or find a group that does them so you can get close to people who similarities to you, so that when you are struggling with stress or whatever, it's not just self-care. You have somebody to reach out to in addition to self-care. So,
indeed.
Really
Thank you.
So I was listening to you bring up faith, and I wanted to know your standpoint on how faith can shift your perspective of mental health and how it can shift it in a positive way. And what are your practices in faith that help you simultaneously grow within your faith, but also grow within your mental health as well?
that's a great question, and it's a big part of who I am. So, one thing I think you talked about struggles before, and how faith kind of shifts our perspective on our struggles. So what I've learned to do is, like, if something negative does happen in my life, like, I ask God to show me why, or to show me how to use it, right? And so I talked about being a widow, right? And so I lost my husband suddenly in May of 2020. And a few months before that, I was really trying to figure out what God was doing in my life, because where I was working at the time, the people he was bringing into my life, like, I didn't understand it. And people around me didn't even understand it. They were saying, like, why did this happen? Why did this person call you in this particular situation, for example? And I was like, guys, I have no idea. Like, I would have people who weren't even my friends, who I barely knew, calling me in emergency situations late at night saying, like, can you help me with this? And I would always go. And and the whole time people are like, what is going on? And I'm like, I don't know. All I'm going to do is keep showing up and helping. And if I can help, I'm going to help. So a couple of those people were actually widows. It was one of the calls was someone had just lost their husband. Okay. And then I get to May of 2020. So one of those happened in September of 2019. One of them happened in December of 2019. And then I get to May of 2020. and my husband suddenly dies. Okay. And that same day, one of those people who I'd helped called and said, "Is it true?" And I was like, "Yes." And now I know why God had you call me. So, and sometimes we don't always understand like when it happens, when something happens, but when we put all the pieces together, it's like, okay. And now that I'm working in behavioral health, like I would not be as effective at doing what I do today without that loss, because I had to take each one of my kids through a different kind of counseling, had to access the behavioral health system for them. And each one of them wanted something very different. One of them wanted group counseling. One of them wanted individual counseling, and one of them wanted virtual counseling. And their perspective of counseling at the time, like one of them was very positive about it. The other two were like, I don't know if I really want to do this, but if I do it, this is what I want to do. And so I had to find the right fit for them. And that was hard. And so if it's hard for me, someone who has insurance, who's white, yes, my kids are biracial, but I'm showing up as a white person, like saying, I need this, I need this. Imagine how hard it is for a single Black mom to do that same thing. And so that loss for me, like, opened my eyes. So when I was asked to do this, be the behavioral health bureau chief for the city, like, it wasn't my professional experience that made me feel like confident that I could do it. It was what God had just taken me through personally, that I literally, the day I was asked to do this, I was sitting in an office, was asked to do it. There was a window. My chair was swiveled, and I literally turned and looked out the window and said, okay, God, like, how can I say no to this? Right? So God took me through what he took me through so that I can help other people. And that's the perspective I want people to understand, is like, there's light in the struggle. And so, and the practices that I use are, I start my day with prayer. I also have a midday reminder on my phone for prayer, because sometimes our days, I'm sure like your guys are just crazy. So you need that moment, even if it's just 30 seconds, to bring you back to yourself, right? Because we're literally like responding to people all day or on social media or whatever. You got to come back to that quiet space and check in with yourself, right? So we've talked about checking in with yourself. So that's my way of doing that, just in middle day. I don't necessarily have an app reminder for that. It's that prayer reminder that I'm like, either thank you, God, or God, help me with this. And how am I really doing right now? You know, and if I know I need to step outside eventually, I'm like, okay, where in my calendar where can I get a break here where I can do some self-care? So
I want to commend you for that. Thank you.
Yeah, you're welcome.
That it really takes some strength to do that, and some patience to do that. Patience in itself is strength. It's just a different way to express it. And I've learned within my mental health journey, it simultaneously started with my faith journey as well. And it goes hand in hand. If anything, it's emphasized the importance of faith and the importance of mental health as well. So thank you for piggybacking off that.
No problem.
I wanted to ask if you had any advice for people who were maybe went through some trauma or something, even involving the church, that maybe have turned them away, or even the same realm with behavioral health resources, like from a therapist or CBT or anything. If they want help but are distrusting of just those two examples of resources to try to alleviate whatever they're going through, what would you tell them to either try to help them, guide them forward, or maybe even an alternative that isn't as scary?
Yeah, I think if they went through something traumatic, they need to talk to someone about that so that they can get some tools and coping skills that they might be able to use and to build confidence so they can go back into that situation again. If it's from a counseling or mental health perspective, if it's the same advice. So, I mean, I can tell you, when I first went through my loss, like I've never been like a big go to counseling person. My faith has always kind of been a big component of it, but I tried 4 different counselors when I first lost my husband. So I gave myself time to like just sit in it. And one of my good friends she actually runs a grief center. And she came to me the day it happened. It was during COVID. So we literally just asked people for space. We reached out to only certain people that day and said, this happened today. We just need privacy. We didn't want a lot of people stopping by our house. So I kind of like put my arms around my kids and stayed in our quiet space. But then like after about a month, we were ready to like engage in counseling. And for me, it had to be the right fit. You have to be comfortable sharing with that person, like what you're going through. And you have to be comfortable with, are they giving me the tools back that I need? Also, it's got to fit with whatever your payer source is, right? So if you're paying cash, if you don't Medicare, it needs to fit with that as well. It needs to fit with whatever insurance plan you're on. So we work with people on kind of finding that fit. So if something hasn't worked for you and you are consistently saying like, I really do, even if it didn't work for you, but you're still in the back of your mind saying, I really want it to be a part of my life, then you have to keep trying and finding something that fits. I guarantee you there's something out there that fits you. It's kind of like a life partner or, whatever, like anything. If you want something to be a part of your life, then you've got to keep pursuing options that might be a good fit. Don't give up. That's what I'd say.
Indeed. Thank you.
I do have one more question, and it's more of a free-form question. I'm just interested in if you feel like there's anything that needed to be said today that maybe wasn't said, because we've actually covered a lot of ground and talked about a range of different topics, and I think it was extremely insightful. But is there anything that you feel like needs to be said that hasn't already been said?
Yeah, I think I'd end with this. So, number one, get to know yourself and know your story. And know and find the places in your life where you can share your story, where it will positively impact you and others. The second piece of that is be a light. So you have a chance to show up every day in the spaces that you're in a positive or negative way. And one simple way that you can change someone's mindset or change someone's day is saying hi or making eye contact or smiling. Those things you just don't know, like who you're impacting and how you're impacting them. And the last thing I would say is never give up hope. So I have a tattoo on my arm. It says hope wins. And it really does. Like you can get treatment. You can get all of these things from a mental health perspective that make you believe. You can be strong in your faith. You can have a good support system. When you sit with yourself, you have to believe and hope in yourself. And that can make a huge difference in who you are and how you show up every day. So hope wins. That's it.
Thank you so much. And that is another episode of StitchCast.
Yes, sir.
Thank you everybody for tuning in. We hope you learned something. I would really love to do another podcast with you. Some great questions. Thank you so much.
Yes, sure.
For being a part of this. And we want to say thank you again to Miss Julie Gary for all your work.
Thanks for having me.
Absolutely.
So fun.
Absolutely.
Yes.
And we out.
You're amazing.
Goodbye.
This special edition of StitchCast Studio is supported in part by YouthBridge Community Foundation through Think Big for Kids. Story Stitch's creative youth development programs are supported in part by the Lewis Prize for Music's 2021 Accelerator Award. The mission of the Lewis Prize is to partner with leaders who create positive change by investing in young people through music. Additional support for StitchCast Studio and Story Stitch's programs is provided by the Regional Arts Commission, the City of St. Louis Office of Violence Prevention, in partnership with the St. Louis Board of Aldermen through the 2024-2025 programs to reduce crime among at-risk youth, and Tegna Foundation. St. Louis Story Stitcher Studio, the center, is supported in part by Kransberg Arts Foundation, where Story Stitchers is a proud resident organization. Thank you for listening.
They say who that, but you already knew that. That be them story stitches. Story stitches, story stitches, story stitches, story.